90s were brutal in this regard. Almost every state passed laws making it easier to try kids as adults, mandating that kids go to juvenile facilities, reducing the ability of juvenile systems to move kids out of institutions and into the community, watering down confidentiality protections, and otherwise sort of adultifying and toughening their juvenile justice system. So it's a pretty big change. In 1994 was not just the peak, as the judge said, of institutionalization. It often coincided, not coincidentally, with the peak of fear of crime nationally. That's when 23 states passed 3 strikes and you're out laws, for example. And if you look at the Gallup poll, the number of people ranking crime as the #1 problem peaked in '94 and has been declining every year since. So much so that presidential elections aren't even talking about it anymore, and they were talking about it in the 90s. And the other thing is that this is kind of different than what's happening with the adult systems. I know you guys in Michigan have closed a bunch of prisons, but nationally, we have not seen yet a decline in the adult prison population. They're still going up. They're going up less than they used to, but they're still going up around 1–2% per year. So the fact that the juvenile systems have gone down 27% and started going down prior to the economic crash means something different is happening. It means that I think there's more evidence about things that work, and I think that's allowing elected officials to look at this issue differently than they could look at it during the mid-90s. In the mid-90s, you really just almost couldn't look at it in a different way. As I said earlier, there's a substantial and growing body of evidence pointing to the harmful effects of confining youth in large congregate care facilities that are isolated from their families and communities. Increasingly sophisticated studies are finding that placement in congregate care facilities like training schools may expose youth to more intensely delinquent or disturbed youth, increase recidivism, destabilize the mental health of young people, place them at greater risk of suicide. In fact, some of the studies are showing that some of the advent of mental health disorders occur in the institutions, retard employment and educational prospects, and subject the kids to increasing risks of sexual abuse in the institutions. If you go onto the Justice Department's website, CRIPA, C-R-I-P-A, which stands for the, Civil Rights and Incarcerated Persons Act, you'll see hair-raising reports on more than a dozen states' juvenile justice agencies. The problem I have with it is that so much of that is viewed idiosyncratically, right? Sort of like what Ed said earlier. So the people in Mississippi, the people in New York, the people in Maryland, they experience this idiosyncratically. It happens in my state. What is wrong with my staff at my facility? This department head, right? We have to just get rid of them. And what I think we really need to do is say, is this a system that really works? We should go back to the very beginning of the training school system and see very similar critiques back 170 years ago as what you're seeing right now. So I think it really is time not to tinker, not to be incremental, but rather to go at the very base of this system and question its very foundation. So I want to talk a little about how New York's doing that. I don't know if all of those lessons work for you guys. The more I heard today, the more I started crossing stuff out, because I think in many respects what I heard from you is that a lot of decentralization is happening, and I think there's really a need for some more central consensus, regs and a different discussion about what the state county role should be in terms of fomenting best practices and oversight. But that having been said, I did write the damn speech, so I'm going to get a lead part of it. So New York, in some respects, is struggling with some of the problems, at least that was described to me when I went to Wayne County. Grappling for years to transform its state-centered training school system. 90% of the young people confined statewide come from just 4 places: New York City, Suffolk and Nassau counties, and Rochester, that's Long Island, and upstate New York. The majority of kids are in institutions that are out in the country, nowhere near their families. Education programs in our institutions aren't accredited. So for the first time in their lives, some of these kids are sit in school for the 9 months they're in their system, then they come back and it doesn't count. And actually, the interesting thing is sometimes they actually do well because they're not out smoking drugs, kissing their girlfriend down, or doing whatever silliness they were doing. So they actually pick up credits, but then they don't get the credits when they go back to do that year over. By the way, that's it. They're done. When that happens, they come back, they're gone. They never come back to school again. A recent study by NIJ, National Institute of Justice, found that nearly 90% of our boys and 80% of our girls were getting rearrested by age 28. I think if you told our state system to achieve those numbers, they would have balked. You know, if we said, can you get 90% of these kids to get rearrested within 10 years? I think they would have said, no, nobody hits 90% of the government. But we're doing it by accident. And then in August 2009, the Justice Department did sue us, so that's why we're up on the Cripple website. A year later, the Legal Aid Society sued as well. The kids were getting their teeth broken and bones broken for things like talking in line and asking for extra dessert, things like that. So recognizing these sort of stark failings, not just of our state system, but of the sort of state centralized institution-based system itself, the city and some of the counties have created a range of evidence-based community programs to give our judges viable alternatives to sending young people to state commitment. As a result, for New York City, we've reduced the number of kids being sent to state care by 62% since 2002. And that allowed the state to close 18 of its facilities, what we did in the city as well as what some of the other counties did. But because the state's been unable to capture the savings, they kept the same amount of staff. So I saw your staff-to-kid ratio is not quite 2 to 1. We're almost 3 to 1 in New York. There are about 600 kids in confinement and 1,600 staff at the state level. There's a fierce, fierce battle between the unions and the legislature, as well as some of the small counties where these facilities are, where the only decent jobs are in these facilities. There's this fierce battle going on that's prohibiting the state commissioner from being able to close facilities. So we have these staff, and literally, Governor Cuomo visited one of the facilities right after he got elected, before he even took over as governor, and it had been running for 6 months. There was no kids. It was almost fully staffed. They were on perimeter checks. I guess it was making sure nobody broke in rather than broke out. So what this has resulted in is that the cost per kid per year is a staggering $270,000 a year, right? That's a 150% increase since 2002. So now as a bureaucrat, right, what I do is I come in, I've only been there a year, right? And I go to the budget people and say, well, give me some money to start a, an in-home family service program like MST, and I'll save you this many commitments. And the budget people finally in the city said no, because we keep reducing the number of kids we send up, but we're not saving the money. We're not realizing the savings. It went up by actually $17 million. So we have 150% fewer kids, but we pay $17 million more, even though we're paying 50-50. You'd think we'd be reaping some substantial cost savings. So given all that, the only conclusion that we came up with, what the mayor said, is let's completely take back all services, because then we'll just do it ourselves within the city, and we won't have this, paying extra money for 1 or 2 or 5 or 10 or 100 kids because the state's unable to close down its facilities. So, we think that if we do that in an evidence-based way, it's going to improve public safety, provide positive outcomes for the kids, and provide a significant cost savings. The state has not yet enacted this, but we're in negotiations right now with them. In the meantime, however, we worked with the Casey Foundation to help us establish a network of key stakeholders to plan the realigned system. So we have our presiding judge and the presiding judge for one of the counties, boroughs. We have 2 members of council, so the legislative body's on it. We have the police, the child welfare system, education, mental health, probation, a couple of community advocates, all on there, basically taking the data from 6 data sets and saying to ourselves, what is the network of programming we would like to have if we get our 315 kids back, right? How many kids we think are going to need to be in secure care? How many high-risk kids do we have that need to be in secure care? How many staff secure care? Group homes and multidimensional treatment foster care? And then what is the network of in-home family services we need to create? And then we're going to do bed estimates for those kids based on that data, bed and slot estimates, so that if and when we do get the realignment, we'll have at least pretty decent estimates. Obviously, it's going to have to be fixed after you actually get the real kids in it, because you realize once real human little bodies are in it that it's not what you drew up. But we're going to try and draw it up as well as we can, so that by the time we get the kids, we'll be ready to sort of move them in. So lots of states are doing this thing, this kind of thing, realigning from state care to county care, and they're doing it in very different ways